Dear students, let us start learning about various case or scenario-based descriptive or essay questions, scenario-based MCQs, and reasoning questions that can be asked in the physiology along with the explanation. Let us begin with the case scenario. Master GY, aged 10 years, brought by the guardians with the complaint of swelling of feet and around the eyes. Investigation reveals loss of proteins in the urine. He was diagnosed with the nephrotic syndrome. Below is an image showing edema of the feet. What are the scenario-based descriptive questions can be asked or what is edema or define edema? Edema is presence of excess amount of the fluid in the interstitial space. Interstitial space is the space seen between the cells. Describe the physiological basis for the edema. For this, you need to understand the physiology, and the physiology is stalling forces acting across capillary membrane. So here is the image which is showing a capillary and outside is interstitial space. So here we can see 4 types of pressures which are classified into 2 categories. An outward force which always pushes the fluid from the capillary into the interstitial space. They are capillary pressure labeled as PC, interstitial fluid colloid osmotic pressure labeled as pi IF. There are 2 inward forces which pushes the fluid from the interstitial space into the capillaries. They are plasma colloid osmotic pressure called as pi P or interstitial fluid pressure called as PIF. So the net filtration from the capillary into the interstitial space depends on Kf, that is filtration coefficient, which depends on surface area and permeability, and net filtration pressure. So the net filtration pressure depends on the balance between 4 stalling forces which we have already explained. So applied aspect here, anything which increases the outward force or anything which reduces the inward force causes accumulation of excess fluid in the interstitial spaces leading to the formation of edema. So let us apply that knowledge in few disease processes and understand the development of edema. Conditions like increased arterial pressure or kidney failure causes increased capillary pressure leading to the edema development. Conditions like failure of venous pumps seen in immobilization of body parts or paralysis of muscle, heart failure or venous obstruction cause high venous pressure which leads to backward increase in capillary pressure leading to the development of edema. Conditions like nephrotic syndrome where there will be excess loss of proteins will be in the urine, or condition like wounds or burns where there is excess loss of proteins from the skin, or reduced protein synthesis in conditions like liver cirrhosis causes reduced plasma colloidal osmotic pressure leading to the edema. Conditions which increase capillary permeability like severe bacterial infection or tissue inflammation also leads to the edema development. In case of lymphadenitis, where there is lymphatic blockage, there is less removal of the fluid from the interstitial space leading to the edema development. So some of the scenario-based MCQ which can be asked for the same case scenario is, what is the cause for edema seen in nephrotic syndrome? I hope all of you know the answer for this. Similar kind of scenario-based MCQ can be set for any disease condition which we have already explained for. In the similar way, reasoning questions can also be set like, what is the cause for edema development seen in patients with nephrotic syndrome, or what is the cause for edema developed seen in patients with severe bacterial infection. So already whatever disease condition we have explained, the similar reasoning questions can be set. Thank you for careful listening.